Thursday Thought Leaders with Harbinder Narula. For our healthcare system to grow and become efficient, it is important that most people stay away from the hospitals until it is absolutely necessary. For this, we must strengthen our out of hospital care. And today I have with me Mr. Vishal Lathwal, the CEO of the Apollo Home Healthcare, someone who is playing an important role in transforming home based healthcare services in India through his work at the Apollo Home Healthcare, where he is focused on providing a personalized care solutions that bring professional medical support to patients' homes, aiming to bridge the gap between hospital based care and home recovery. Let's speak to Mr. Lathwal on what he does, how he does it, and how will it impact the healthcare industry in India. So, Mr. Lathwal, thank you so much for joining us today for a conversation related to out of hospital care and home care services. Uh, How do you see the home-based healthcare evolving in India? How big is the opportunity? And keeping in mind that we have a growing demand for personalized and long-term care that is there in this industry.
Right, great. So, firstly, thanks, Arvinder, for getting me on the conversation. It's always a pleasure to connect with you. I know we've spoken about this topic a couple of times, but I think it merits long conversations, right? I think healthcare has come to the fore in terms of layman conversations post COVID, post the pandemic. And as we know, the relevance of home care has gained multifolds, right? After the pandemic, it's not a nascent sector, right? It has cultural origins to safely say, right? In Indian context, family structures have supported non-medical needs, right, of people, correct? We are a caring community, right? So community-based structures have always been there. But home healthcare as a business and more on the medical side of things has only been a nascent sector, right? Still a sunrise sector. There are hard metrics, there are numbers in terms of market size. So the market is expected to be around in the range of 10 to 11 billion at this point in time, USD, right? And I think it's among the fastest growing in the overall healthcare segment. So while healthcare is growing at about 14-15% CAGR, I think home healthcare is around the 19-20% number, right? So which is significant, correct? So the industry doubles every 3 years or 3 to 4 years. But I think going beyond, so closer or more relatable numbers would be, for example, look at what is happening to on both the clinical and the non-clinical side. So India's healthcare penetration is still quite underserved, right? We are a country of huge population, right? But at the same time, the number of hospital beds that we have, the ratios there, whether it is beds or it is doctors or it is the paramedic capabilities, those are still very, very short, right? And short by a margin, right? It's not that we are close or we are just in close margins. It's huge. The gap is very wide. Having said that, what is happening? There are two key trends that are evolving, right? One, uh, we are seeing increasingly more hospitalization happening now, right? Because of awareness, uh, more insurance coverage happening in, right? The disease burden, the construct of the disease burden is changing, right? So India, for example, we are a country of 140 billion. There are about 3 to 4% hospitalizations happening every year. So we are talking about 50, 60 million people going through the hospital journey every year. This is on the medical side of it, right? And if I were just to take a thumb rule, anywhere from 20 to 25% of these people will need some continued care, either pre-hospital or post-hospital. So we're talking about 10 to 15 million minimum conservative estimates of people requiring continued care, right? So that's on one clinical side. So that there's data enough, and we all know it, right? We are seeing this trend. Increasingly, people are taking up elective surgeries. You are going and seeing the doctor more often, right? So that's happening. Now, at the same time, if I look at the non-clinical or the social assistance element of care, right, family structures are dissolving, right? Families are they're shrinking to the extent, right? If you just to look at numbers in, I think, pre-1980s, the family sizes were around roughly 5.5 to 6. It took about 20 to 30 years or 2 to 3 decades to move from the 5.5 to 4.5 or 5 number. But in the last 2 decades, the numbers reduced to sub 4. And this is even stark in the urban communities, right? Rural is still holding on to those numbers while it is declining. discriminating there as well. But if you look at urban family sizes, it's sub four, which means that the concept of seniors and families and three generations living together is no longer happening, right? And we are seeing that. So one is the market size of it, but at the other element, if I have to break clinical care and the non-clinical or social care element of it, I think both the data sets clearly denote that there is a market which is only going to grow multifold, right?
So, Mr. Lathwal, home healthcare is a critical component of managing chronic diseases. Uh, but are there some conditions that you feel need immediate care at home while recovering from procedures and treatments at a hospital than other diseases, other conditions?
Okay, I'll take a step back. I think the question is very relevant. See, home care today, or probably even a decade from now, is will not be able to substitute hospital care, right? But it can definitely complement, right? And there are those opportunities. So, for example, I'm not going to talk about the long-term acute care of cases, right? Patients requiring long-term assistance, etc. But if you were just to look at some pertinent segments, uh, we just spoke about 4 to 5%, 3 to 4% hospitalization rate, right? Surgical mix is going up, right? It used to be sub 20%, now it is north of 30%, in some cases urban cities also 40%, right? Now surgical cases do require some bit of always short periods, but do require continuity, whether it is in terms of assistance or monitoring. Now monitoring solutions are available. So there are segments evolving. So if you see the home care attendant sort of market, that's sizable, right? That represents the 10-11 billion that we spoke about. It represents 60 to 70% of that market today as services. There is a clinical upgradation happening, right? Because the patient, the funnel need or the patient need or the hospital feeder into post hospital care, etc., is increasingly becoming more complex, right? So you have nursing care, but if you go beyond that, right, you have step down ICU care, right? And that segment has come about significantly, and especially over the last 6 7 years, right? Simple reason, we just don't have enough ICU beds. So while our hospital beds is about 1.42 thousand versus a global benchmark of 3.5, our ICU beds are 0.01. Right? That's the stark difference because it's expensive, right? It requires a lot of capital, and not just hard capital in terms of money, but also talent, right? It requires intensivists, etc. So it's a tough piece to administer, but at the same time, there's a growing need because more and more people are going through this, and at the same time, the cost delta of doing this at hospital versus at home is much stark, right? Home care treatments for such critical conditions are about 30 to 40% of hospital costs. And India as a market remains largely out of pocket, right? So hence that the need is even more compounding. Hospitals and providers have also started to realize that for them to decongest, because they need hospital beds to be made available for more active cases coming in, right? So the moment you get into either sustenance or a recovery that can be supported at home, right, there is a much more benefiting argument, right, for all sides, whether it is providers, patients because of lower costs, providers because then they can manage occupancies for more critical cases, home care, of course. And the other reason home care is also supported is because talent, much like all other segments, is also seeking flexibility, right? After a point in time, people don't want to engage with full-time jobs, especially on the nursing paramedic side. So the gig force economy is also going to play out in healthcare, not just only on the e-com and logistics side of things, right? So we are seeing all those trends playing out.
And Mr. Atal, there are these pure play out of hospital care models that exist. And now lately, hospitals have started taking these models as an extension of their services.
Yeah.
What is the reason that hospitals are looking at it as an extension of their services rather than collaborating with pure play out of hospital care providers? What is the benefit for them? What is the need for them to start focusing on this business as well?
Right. So this segment in India, at least the organized segment, was not started by hospitals, right? Because running hospitals versus running home care is chalk and cheese, right? But it took a very short while to understand the benefits of hospitals doing it, right? And there are strong tangible benefits beyond just the business metrics, etc., right? One is, of course, a good home care construct requires continuity of patient condition understanding, right? So patient information, care teams, etc. Right. So hospitals are best place because then there is seamless flow, right? You are connected to the primary doctor in some sense, and you understand how is this progressing. And home care is not in silo, right? It's not delivered in silo. Patient in almost all post-discharge cases would have some sort of follow-up happening with the hospital, right? So I think patient demand convenience is the second factor, right? Patients expect private hospitals of repute, etc., to be able to handhold them through the entire care journey rather than just the hospital piece of it, right? So and all good businesses, right? They tend to listen to consumers and understand where is the consumer need moving, right? So uh, uh, which is also an element that insurance has also started coming in the space, right? But we'll talk about that later. So hospitals do it for simple reason that patient demand it. They are in the most beneficial position is with respect to having the infra, the starting position, the care continuity, etc., and that promise, which also differentiates them vis-a-vis other competition, right? Subsequently, patients with continued home care or without home care with the same entity have stark differences in clinical recovery, right? And there's enough literature and more, right? There is enough literature to also say that if you have good home care practices, you have significantly reduced readmissions, which is just bad revenue for the hospital and bad cost, right? It increases the healthcare delivery cost, correct? So, institutions are realizing that patient experience, care continuity, clinical outcomes all get better. Now, if you talk about business metrics, of course, as I said, a patient in a hospital requires active intervention for the first couple of days. After that, it is managing the patient for various symptoms, etc., for recovery. Now, that can be moved out of the system to free up beds, right? So, average length of stay is a metric that is often talked about in healthcare settings. So, if you have a continued care division, it becomes easier for you to reduce the A loss. Not that hospitals are only chasing it by moving patients out, but it becomes much easier to reduce your A loss, free up capacity for at least the non-intense cases, right? So that's that. Second, it's just incremental revenue, right? By virtue of patient retention, right? And it's happening across categories, not just healthcare, right? You have a core product offering, but there are ancillary needs, and you can service those. So hospitals, to my mind, are the best position to do this. The struggle often is that the operating mindset is very different, right? Because hospital, the port of action, the is it's a physical delivery model, right? It's not remotely distributed. You don't have to work on servicing customers across, and right. So hospitals who have put together dedicated teams of businesses verticals to address this have fared a little better, right? Just as a pure extension as a department, etc. So yeah.
So, Mr. Lathwal, one of the things that has actually helped take off as an industry when we look at home healthcare is the advancement in technology. Telemedicine, telemonitoring. You have the devices which are continuously monitoring. The wearables have become a reality today. So it's easier to monitor a patient when you're linked with the hospital. But this has also brought in some kind of challenges because a hospital has a system in place and all these devices, monitoring, etc., need to integrate with it.
Yeah.
What are the challenges that you have experienced as a hospital also running a home healthcare venture? And how did you overcome these challenges? And what do you think is the future of home healthcare with the advent of the technology advancement and remote monitoring?
So I think I get a little tongue tied when people talk about technology. The simple reason is, see, we all believe in it, and I think it's a mandate. Using technology to provide better experiences, to build efficiencies into businesses is extremely important, right? It's the oxygen for any business nowadays, right? If you have to scale, especially in D2C businesses, right? Using tech, whether it is for customer acquisition or for servicing or for monitoring quality, etc., whatever parameters, it's inevitable, right? But at the same time, as you rightly said, the issue is that uh, tech, uh, the tech plane health is yet to mature, if I were to really call it, right? Hospitals now are in a position to have strong systems of HIS, right, or billing or whatever, right, or even EHR, and that adoption has taken a very long period, right? Because even on the supply side, you have to gear up systems, right? Now imagine a, a movement of that into a remotely distributed environment. The issue is today there is no one solution that helps plug the gaps, right? Only now we are looking at solutions which are open architecture based, can talk to each other seamlessly, right? But technology is moving so fast that for a provider to ascertain and decide whether they should build it in house versus they should plug and play, it's changing so fast, right? Uh, that it's it's the decision making has become very difficult, right? It's compounded also by the fact that health tech is yet to monetize, right? Where the core solutions, etc., are all great, right? But they don't. None of the patient-facing solutions, etc., have delivered great success or relevance, right? Whether you talk about patient monitoring systems, of course, there is a benefit there, but the cost-to-benefit ratio doesn't match, right? Second, there is no one provider who's solving the entire gamut, right? People are either solving chronic disease management on one side, somebody is solving for portable machinery, right? Devices don't integrate with these. There are only select devices. The costs are up for patients, right? Patients are anyways paying out of pocket, especially when we talk about the non-hospital space. So so the cost benefit situation today doesn't really stack up to favor new technology or health tech interventions. But I think as technology architectures overall mature for healthcare, right, with bigger players coming in, right, and even smaller ones, right, for that matter, I think this should solve out on its own, right? It'll take its own natural course.
And Mr. Lathwal, since you were talking of decision making, one of the challenges when it comes to shifting the patient home is that the family sometimes feels that a patient gets a better care in the hospital. So can you keep him for 3 more days, or can you keep him for a few more days so that he's being observed? uh, that requires a lot of education, awareness, creation to ensure that patients and their families feel confident about receiving the same level of professional care at home. As in hospital, what is it that Apollo does so that the patient feels comfortable of receiving the same level of care by Apollo home healthcare as he would receive at the hospital?
Yeah. So India is a country of many personas, right? Uh, so there are patients uh, who require clinical solutions, right, at home, and a large part of this, the trust is bestowed to the physician or the clinician in this case, right? As Apollo, I think it's an institution built on the ethos of doing right things for the patients, right? Apollo Home Care has been in standing for about 9 years now, right? Just nearing a decade. All our protocols, etc., are sourced from our own learnings of delivering 4 decades of healthcare in the country, plus also globally benchmarks available, which is why Apollo Home Care was amongst the first few branded home care providers to get into an accreditation, right? Um, uh, because while growing is one metric, but growing at scale and delivering the right quality is equally important. So for patients who need clinical care, physicians end up endorsing some part of that demand, and our physician confidence is built on the premise of, one, each patient goes out with a personalized care plan, right, which is which is a mandate before onboarding a patient, right? This is overseen by both technology and physical models available to us, right, and it flows back to the primary physician, as I said. So that connect is very, very important. Home care can't be delivered in silo. At the same time, then we have a huge structure that ensures clinical quality, right? All of these are doctors and nurses available, one managing patients remotely. Then we have uh, on the ground supervisory layers mapped to a small ratio of clinically oriented patients, right, who go in at every point in time if any specialized procedure or care has to be done. At the same time, all our caregivers are actively trained and they have systems and tools available, right, to either seek out help or to review the care progress, etc., right? So that's where technology plus the right training, plus the right SOPs, and I think the ethos on which the company is built really comes into play and separates us as a brand vis-a-vis the competition. But having said that, if I take a larger answer, home care in India is still only 2% organized, right? So while I can speak for Apollo, but if I speak for the sector, I think there's a large effort that is needed, both from institutions, etc., playing in the space, but also from the regulatory bodies, right? Home health care is not an organized or a recognized segment,
Mhm.
right? Like much like diagnostics or other pharma that has come to the fore. But home care, I think some of the policies, etc., are still dated. We have to do a lot of work to get this to the mainstream, right?
Right. And Mr. Lathwal, one of the challenges that I uh, could think of when we are talking about home health care is that of getting enough trained manpower. One of the this is also a challenge which the hospitals are facing. They don't have enough nurses, and it's a challenge to retain trained manpower even at a
Yeah.
large hospital today. So what is it that you are doing to overcome this particular challenge? How do you ensure that you have enough trained manpower which is available to service the kind of clients that you have? And while you answer this, I would also be very keen to understand, because this is not just about skilled manpower. It is also about the soft skills, uh,
Yeah.
because when you're dealing with a patient at home and their family, which is all the time around, and you also have to look at the security. I mean, the ensure that the services being offered are secure for the patient as well as for your employees who are going to
Yeah.
a particular home environment.
Yeah. Yeah. I think it's a question that you picked right off the book, right? So this, in essence, defines the day-to-day of home healthcare companies, right? So, see, there are two issues with talent. One, as you rightly said, just supply in itself, right? We are half of what we need as nurses in the country, and maybe even more if I look at a higher organized play for home care. So we have about 2 million odd nurses, registered nurses in the country. If you go by WHO standards, we need exactly double of that as of today, right? But we're only adding about a tenth of that every year. So which means it will take us 10 years to plow back that number plus, right? So we are quite behind, right? Uh, at the se- and the second issue is the quality of it, right? Uh, Now, there is an opportunity to solve this, right? So a couple of things that we do is, one, of course, each of our staff is selected through a process of understanding competencies, and it's not just technical, as you rightly said, it's also behavioral mapping to understand are they fit to work in environments where they are non-supervised environments, right, where directly facing patients. uh, uh, so in my 9 years of walking the floor, etc., and being in hospitals and home care settings, there's a slight dichotomy in the education system of how we train our nurses, right? Across the 3 4 years of whether you're a diploma or degree candidate, you're told to be subservient to the physicians, right? Take orders, and suddenly in a home care setting, you're expected to be right out there, right? So the behavioral element, as you rightly said, is equally important. So what we do is our hiring processes are designed in a way that we know both to a large extent, right? And after that, we have a 30, 60, 90, 180-day, 2 year, 1 year program, right? We have a not just a career progression chart for all the nurses that come into the system, but also a skill matrix, right? We have skill matrices of nurses that can handle critical or advanced care cases. Then we have skill matrices where you can handle basic cases. And compensation incentive structures are linked to all of these, right? Because essentially it is about building accountability at the talent level, right? So that's one. So it's strong training architectures, competency linked frameworks, incentives linked uh, towards upskilling, right? And the right matrix of behavior, orientation, etc., right? All our staff is background verified. We Because we are sending somebody into our patient's home, right? It's a simple me test, right? My family test. Who would I want to come into my house, right? So we do that. At the same time, each of these people are provided tools, right, to standardize care delivery. So they have tools available to them, and supervisors to reach out to for any specialized procedures, etc., that may be warranted, right? They know the exact care delivery that has to happen. They know that if vitals have to be monitored, at what time do they need to monitor the vitals. So it helps them, it enables them, right? uh, so at one level, we make sure that we have the right people coming in. At the second point, we make sure that they are continuously upskilled with the right incentive models for them to do that and building accountability. Third, giving them enough tools, right, to execute day-to-day tasks, right? Uh, the good thing is in a home care setting, the care ratio is 1 to 1. It may not be beneficial to the business, but it's beneficial to the care provider, right? They don't experience the same level of burnouts that they would in a hospital, right? So that's the silver lining in some sense, right? And I think you had another part to that question, right?
So I'm saying, how do you basically overcome these kind of challenges?
Yeah.
And are there any other challenges that you're facing apart from just the manpower?
Mm. Mm. So so on the manpower, this is, yeah. So the other part was also safety, managing safety, right?
Correct. Correct.
Uh, so uh, Apollo Home Care deploys safety mechanisms and safety protocols by way of doing two things. One, each of our patients, when we onboard them, we do a profiling to figure out where can we deploy a service. Is it in a remote area? Then the caregiver will need transportation support, right? We also assess uh, in terms of, we also assess the construct of delivery, etc. That is it, would we need more than one manpower, the do's and don'ts of what a nurse is supposed to do versus what an attendant is supposed to do to build pride of profession, right? uh, we also give them safety mechanisms in terms of if they're out on the road, right? Not just at patient home, because they're traveling into locations, they're working odd hours, etc. That, so we have provisions available in terms of equipping them with self-defense techniques, providing them the right gear, right, in case something goes wrong. They have alert mechanisms to reach back to us, right? So those are the things that we do, because their safety is paramount to us, right? There is no, because as an institution, we still believe that if we take care of our people, they will end up taking care of patients in the same manner, right? Other challenges, I think, beyond staff availability, I think one is, as I said, technology and technology interfaces and relevance of technology has to mature. But if I were to take a more macro view of the business, I think regulations is something that this sector needs, right? Just to push the organized play a little more, just to expedite that shift, right? Because today all it takes to run a home care is a couple of nurses that you may have, right? And with millennials getting more enterprising, etc., it's much easier for nurses to go out and do this themselves. So I think some bit of standardization in terms of licensing needs, etc. Correct. Also taxation benefits to home healthcare across new age delivery segments like equipments, etc. Right. So those are still not covered. The other big fillip point will be payers, right? Insurance coming in,
Mhm.
correct? So given that this is largely out of pocket, there are some insurance companies who've sort of come forward and put promising products. Some corporates also ensure that their employees, at least beyond a certain level, are covered for post hospitalization or home care. But I think insurance is going to be the other thing. The third thing is, I think, while bigger players like Apollo and others network providers are waking up to this idea, I think across there are many hospitals or providers that still have to understand the relevance of continued integrated care, right? So I think these three will be the other points at a macro level.
And Mr. Lathwal, home care is all about a collaborative effort, because it is, the patient himself or herself has a certain responsibility. Uh, the family is also involved as a caregiver,
Hmm.
and you know and they have their own set of expectations. So how do you educate the patients and their families on the care and their role to ensure that it is a beautiful collaboration leading to a good outcome when it comes to home health care?
So you're right, families play a huge role, correct? Because see, the one of the other advantages of doing care at home is that it's a familiar environment for the patient, right? And there are enough and more data points to say that patients react very well to less stressful, more familiar environments, right? Their recovery is much better. Uh, and increasingly, we are seeing families becoming more cognizant of patient needs and demands and actually supporting care providers at home, right? Uh, but it does require counseling. It does require, as I said earlier, that we do let them know on what are the do's and don'ts, right, around the patient, correct? Often, when you come into home environments, families do have the temptation or tendency to sort of jump frog and leapfrog into getting themselves involved in the line of treatment and understanding, right? But the fact that we have our doctors and our senior nurses visiting the patient almost every week, right? That conversation with the attendants is really beneficial, because if there's one thing that patients really listen to is doctors beyond nurses, right? So we use that very well to let them know that what's the progress that's happening, because uh, the biggest question, like in a hospital, is where is the nurse, right? Where's the call bell? Who's coming? In home care is like, what's happening? How long will it take? Right? What's the recovery? So if you're able to manage the anxiety of family members by addressing some of these questions, letting them know what is happening, right? Visualizing recovery for them in some sense beyond what they see, right, by themselves. I think these are, if you're able to address these points and at the same time keep educating them, right, on what's the patient condition, what is their role in the recovery, because a large part of the moral support, etc., for some of these cases, right, it has to come from the family members. But at Apollo specifically, we do have care counselors, right, who are psychological counselors that go beyond just the clinical needs of the patient. Because as an entity, Apollo does address very, very complex clinical conditions, right, and very high sensitivity cases, including neurological cases, neuroscience cases, oncology, cancer patients, right? So we do have palliative care offerings that do require us to take that one step ahead and counsel both the family and the patients in terms of what's going to happen to them, how is their recovery, how are they responding to the line of treatment, etc. Right. So I think it's a joint effort to that extent.
Well, have you ever faced situations where you felt the need to manage the expectation of the family because there are cases when the attendant is given more tasks than what the attendant is otherwise expected to do. Have you faced these kind of situations, and what is it that you do about those?
Yeah, every now and then. And I think the good thing is that, see, uh, it's part of uh, it's part of delivering care, right?
Mhm.
So for us, it's not a rewritten, to be very honest, right? It's what is taught through the organization, right? That whenever we get any of these cases where we feel that the patient is, or the family is being little unreasonable, right, in terms of, I think we take it with a pinch of salt. We understand that uh, they're also equally anxious, or probably more, right, because they're family member, right? So healthcare is not easy, right? Nobody comes in happy into this business, right? Unlike others, right? We are not selling the most positive product out there, except for birthing, right? Birthing are positive cases, right? All's good. But everything else, we understand that it's a negative space. We are dealing with a lot of pressures, etc., while financial also, right? So people come with very different points of frames of reference. So I think the whole organization is mentally and behaviorally tuned to address it calmly, amicably, let them know what are we doing, and we are the right professionals to take care of it. So I think we get a lot of it, but not so difficult to manage, to be very honest.
And Mr. Rathwal, I've always been very curious to understand, how do you ensure the medical legal responsibilities in a home healthcare environment? How does it typically work?
So the medical legal obligations carry on similar to hospitals, right? So the only way to to sort of offset it, right, is first to not let it happen, right? And what you do for it is that you document every episode, every intervention, right? You have progress summaries, you have nursing notes, you have doctor notes, right? You document everything. uh, we also internally for the caregivers have a principle of do no harm, right? Patient safety first. So each of our caregivers is given a free line, right, to do whatever it takes to ensure that the patient is safe. I'll just give you an example, right? I won't take much of your time. So a couple of months ago we had a non-nursing attendant at one of the patient families, right? And they realized that the patient is facing some discomfort, etc. They did not bat an eyelid. They booked a Ola, Uber, etc. They've reached out to the supervisor, but in the meanwhile they said that I am booking an Ola, Uber because the ambulance is not coming and we don't need an ambulance because the patient is still mobile, etc. But they felt that the BP is dropping, something's happening. What can we do, right? They went ahead and took that call, correct? Because by the time my doctor could have reached, it would have taken half an hour. Within the 10 minutes, they would have been at the hospital. So they were at the hospital in 10 minutes. They realized that it was a sugar episode of low sugar, etc. Where patient was taken care of, right? Uh, and the organization sort of reimbursed. The provider did not think twice, right? And these are things that we sort of celebrate within the organization, right? That's the spirit of care that we want to transcend across.
Got it. And Mr. Rathwal, you brought in the topic of insurance a couple of times while answering the earlier questions. What is the coverage that is available as on date for home healthcare services? Are they covered at all? And where do you see, it heading in the future? Do you think the insurances are going to be covering this? Because, like you said, one of the bigger challenges of a hospital is to have more beds for active cases, to have more beds for ICU cases than for those who can be served at home.
Yeah. See, the future of insurance in this space is inevitable, right? Not just because of consumer push, etc., right? Because people are paying much higher premiums now, right? We all know premiums are growing by double digits post pandemic, correct? And there's an emergence of tech companies also, right? And they're also trying to differentiate themselves on product offerings. And at home continued care is becoming consumer demand, right? So that's one consumer push for insurance to get into this. But there are also very strong reasons in terms of healthcare costs are much cheaper, right? Delivery are much cheaper, right? Uh, uh, the other thing is uh, some procedures require this for better recovery and reduce readmission, as I said earlier, right? Which will also in turn lower the cost of future admissions or right relapses, etc. So it's a win-win proposition from insurance. I think the deterrent today is, as I said, the organized segment is too small, only 2% of it. So the risk fraud in terms of billing, etc., is too high for them to enter in this space, right? So that's one deterrent, correct? And then the other question that you asked is what's the coverage today? So insurance companies, a large part cover, let's say, uh, post hospital care to the extent of physiotherapy and rehab. I think 2 months is a standard across most policies, right? So that segment is covered. Nursing care and attendant care is covered by certain corporates via corporate programs or insurance via certain premiums, especially for seniors. Now, I think it was a welcome move that insurance has gone for seniors as well, right? Which was earlier so difficult. Although the premiums are still overpriced, right, significantly, but I think it's only a matter of time. But it's a welcome move, right, that seniors are getting covered now, right? So insurance is also playing out with innovative models by tying up with home care providers or out hospital care providers. For example, fever is a large part of our hospitalization numbers in the country, right? Infectious disease. Some of these cases can completely be managed at home without really requiring any hospital stay altogether, right? At a much lower cost, at a fraction of the cost. So there are these concepts that are being tested regionally, right? Uh, the issue is actually awareness and adoption, right? Consumers are largely aware of hospital stay, what is covered, but I think most benefits of insurance companies are not either clearly communicated or clearly understood by people who are buying these policies, right? A large part of the Indian diaspora is still covered by corporate insurances, right? Beyond public sector. Most of us don't understand what's really part of the policy,
Mhm.
right? So while insurance companies, for example, Star Health, and we have a couple of those tie-ups at Apollo, right? They came out with a PR article, but the adoption to some of this, the knowledge, awareness, etc., is something which is gradual, right? But as I said, we are fairly bullish on this because it will happen, right? The only thing is home healthcare as an industry has to organize itself and ensure that we are solving for experience, cost efficiencies, and and clinical effectiveness for the insurance companies to bring in. Because they would want standardized protocols, right? And home care is very difficult to standardize by definition,
Mhm.
right? So I think a lot of work has to happen there.
And what percentage of the cases in home healthcare are palliative cases as compared to other continual treatment
Yeah.
cases?
Yeah. So the answer will vary significantly if you're talking about the overall market versus branded players, right? Overall market, the number will be minuscule, but branded players, I think, are increasingly developing capabilities to manage such cases because it requires multidisciplinary approach. It's just not sending a nurse or a doctor, right? As of today, if I were to look at the mix for branded players, uh, it's equally split between nursing and non-nursing. And within nursing, right, the top 15 to 20% will be a mix of critical care and palliative or such cases, right? Uh, it's also because the hospital feeder capacity for these cases is going up significantly, right? Cancer is a huge burden for the country. We know it, right? More and more people are coming out and seeking treatments, right? Uh, I wish we could move more on the preventive side so that such cases don't come in. But as it is, I think we are a country of huge proportions, right? So we will have, instead of wishing that yes, we all start caring for health. Of course, that has to happen. At the same time, we have to gear up for what's out there, right? So roughly, as I said, 20% of nursing, which is 50% of the total portfolio.
And Vishal, one of the things I'm always very keen to understand is, like you said, that healthcare is an environment where everybody's working around sickness or not so pleasant
Yeah.
environment. Now, hospital is still an institution where, as a corporate, you have a responsibility and you can do certain things for your employees. But in a home healthcare environment where people's workplace is somebody's home and they don't come back to a corporate environment, they go back to their own home. How do you as an organization create a positivity for your employees so that they can think of beyond the stress which is at the workplace, as well as everybody has stresses in their own personal life as well? So what is it that you do as a company to look after your employees?
Yeah. So it's very difficult, right? I wouldn't claim that we've done the best that we could. The reasons are twofold, as you rightly said, that these are remotely distributed environments, very difficult to bring back people at the risk of disrupting clinical services because at every point in time, the whole industry is running short of supply, right? So, but at the same time, we do have norms in terms of ensuring that our teams are taking the offs that are needed, right? We ensure that we have adequate buffer and bench capacity to provide relievers, right, as and when needed. Uh, Taking care of our employees is a principle within the organization that we strongly follow, right? So we have listening forums, we have listening posts. Each of our caregivers are covered via benefits of medical insurances, etc., to take care of their own sickness, etc., because they're traveling, they're always out there, right? So we cover them through accident policies, we cover them through medical policies, and these policies cut across. They are the same for all employees, right? So it's not that there is any marginalized treatment there. We also, I think, we these virtual formats of engagement are increasingly playing a large role in our ability to reach out to all our workforces at the same point in time, right? So we do make sure that we adequately use those, right? And we do find the often chances of celebrating festivities across, right? We do reach out to each of our patients and the caregivers at the same point in time, right? uh, uh, the good thing is that last mile delivery associations have become much easier to execute, celebrating their birthdays, celebrating their special moments. So I think those are things that we continue to focus upon. But I think the biggest thing is this solving for their work, right, in itself is a big component of relief for our nurses, right? So just automating their workflows, I think, is the biggest stress buster for them, right? The Indian system, there, while they're clinically competent, etc., taught on that. We are very bad as a country in terms of documentation, right, or following processes, right? So we made those very idiot proof in some sense, right, for the lack of a better word. So a nurse's life is much simpler. All the non-clinical activities are so streamlined that they don't really have to think too much on that side. All they have to think of is compassion in the right, the procedure is done in the right manner, right? So to my mind, I think that's 70% of the problem solved. But then we have other things that we try and take care of. But if you really ask me my personal answer, I think there are a lot more can be done. To be very honest, and I would, while I have a certain bench, I would have loved that we have more and more capacities and we could use more clinical fleet on street.
And Mr. Lathwal, while healthcare is an environment which is surrounded by a lot of negativity and sadness, but it is also a very satisfying place to go and serve. Uh, but as a CEO, uh, you have multiple responsibilities. You have to figure out solutions for getting adequate manpower. You have to look at financial sustainability of the business model. You have to look at the growth. You have to look at technology advancement. And then you have your personal side of life. How do you personally balance your work life balance? And are there any passions that you are uh, pursuing which give you that uh, freedom from stress to think of innovation in whatever you do?
So see, I think this question is industry agnostic, right? But
Absolutely, absolutely.
but to a large extent, you're right. See, healthcare would keep me on my toes. But even if I were, so I have a background in consulting and I have a background in automobile marketing before I had. I mean, healthcare was more a chance opportunity, right? To be very honest. But I think I'll choose it every now, whenever I get the chance again, right? So I won't miss out on it because it's so gratifying to see what you're doing, right? These are real solutions, right? You get to see what is being delivered, right? uh, so I think there is a huge debate and argument on where do you sit in terms of work life balance, work life integration, whatever you want to call it. I think uh, it's a question of balancing priorities in life, right? So to my mind, I figure out those opportunities in terms of a what is it that I love to do within my work portfolio. There are things as a CEO that I practically hate, and I wish there was somebody else to do it for me, right? Like signing checks, etc. Right? I just hate that work, but I wish, right? At the same time, but there are parts to my job which I really love. For example, I often find time to go and meet patients, right? I find time in their own settings. I go and talk to the nurses, the millennial nurses, right? On how do they think about care? Because as millennials, we feel that their care orientation is quite limited, right? But you will be surprised to see when you go out there and speak to a 22-year-old on how they think about this profession, right? Versus somebody who's a 40-year-old. At the same time, but I have personal interest. I think I make sure that, see, life is a combination of whatever you do, and I think uh, if I'm mentally satiated, if I'm in good state of mind, I will be a more effective leader for my people, right? So I pick up my car and I go for drives. I'm a petrol head, right? So uh, I do off-roading as and when I get the time. I used to be in fine arts and theater and dramatics, but now I can't give a lot of time. I think the other piece that has picked up for me is now I was, I mean, me and my wife, we were blessed with a daughter a year back, so I think she takes up a lot of time of ours right now. And I think just sitting with family, I love bonding, and I think they keep me grounded, right? Because when I go home, there's no CEO, there's nothing, right? So it's just me going back to my people, right? So a lot of things, but I don't really think too much about work-life balance, integration, etc. I think I live in the moment, right? So if my work needs me at that point in time, so that's the priority. And then if there's family thing, then I think that takes priority. So it's balancing priorities more than, I don't compartmentalize my life, right? So it's no weekends, weekdays, but I make sure that I find my own time, right? So I do a lot of these things.
You're right. Every CEO has a CEO at home, but but you know what? Congratulations on your daughter, and I think children are the biggest stress busters.
Oh
Spending time with
yes.
them, especially the small kids, that can be a very pleasant experience. Uh, but Vishal, thank you so much for taking our time. It was very pleasant to understand that when you spoke about that your work that you do as home healthcare provider, you're not just trying to organize an otherwise fragmented space, but you're actually contributing towards increasing clinical recoveries,
Yeah,
outcomes. You spoke about reducing readmissions, increasing or bettering the patient experiences because they are in their safe environment, or so they feel that they are in their own comfortable environment. And also, it is relatively less expensive to get care at home compared to a hospital. And I think, just mentally also, you feel a little more relaxed when you're at home, because if you speak to any patient in the hospital and you ask him what needs to happen, they're like, please, when are
घर
you
जा.
stay home? Ghar kab bhej rahe ho? And also, what you mentioned as one of the advantages of a hospital looking at offering this services, because the patient's history is already known,
Yeah,
treatment protocol is already set. So it truly becomes a plug and play model
yeah.
when it is a service which is an extension of care which is being provided in the hospital. And but thank you so much for sharing all this with us. It has been a pleasure to have you at BW Healthcare World.
Thank you, Harvinder. Thanks for connecting in, and I couldn't have summarized it better. So thank you.
Thank you.